Good afternoon. My name is Eric Macklin. I'm the chairman of the Nancy Griffin Fund, which is the sponsor of the Macklin Medical Mission. The Macklin Medical Mission has been around since 1886 and is one of the oldest fundraising charities in Canada. Today I'm here to talk to you about raising funds for various cancer treatments. As you know, radiology has been around since the middle of the Second World War and deals basically with a burn technology, very focused when they do it in the lab, and has a number of side effects which we are all well aware of. The other cancer treatment is chemotherapy, and it has been around since approximately 1885, and it deals with a number of chemical concoctions which deal with various types of cancer. Unfortunately, both of these treatments are not ideal for the very young and for the very old, especially for the very old if you have any other ailments such as liver problems or kidney problems. But today I'm here to talk to you specifically about pathology in terms of cancer and the human body. As you know, some bodies have been able to deal with cancer. This is why cancer only affects and deals medical problems to, say, 50% of the population. About 10% of the population can handle cancer. The body system, through the immune system and the white blood cells, will find the cancer and will ultimately deal with it, disposing of it. Many instances of people have been noted in the medical journals, especially the New England Journal of Medicine, whereby some people will have cancer, will develop tumors, and when they go back to the doctor, suddenly it's all gone. Now, those are very rare cases. In another 10 to 15% of the population, you'll find that people, what I mean is that the human body, for about 15% of the people, will have cancer, but it will reach a stalemate in which the body is able to deal with the cancer, but not completely. The other 50% of the population, when they get cancer, and as you well know, cancer comes in various and a great many forms: brain cancer, liver cancer, kidney cancer, cancer of the breast, ovaries, you name it. Cancer seems to have its own little favor with each body. But the very interesting thing is that down through the years, physicians, lab technicians who have their PhD who deal with biochemistry have noted that the main agent in the body that deals with cancer is the white blood cell. Through a number of interesting studies, and there are a number of clinics that are going on right now, is that from the patients we are able to take white blood cells. We'll take a small biopsy of the typical type of cancer. We'll put them in a petri dish in the lab, and then what we will do is, from the same patient, we will take some of their T cells from their blood marrow and work together between the white blood cells, the T cells, and eventually re-educate, if you would mind calling it, or translational, some people call it, or simply re-educate and modify the white blood cells so it identifies the white cancer cells, which are bringing a lot of problems to people, reintroduce it back to the body in much the same way as an immunization course of treatment would have, and cure the white and help the white blood cells kill the cancer. This is still in various clinical trials. If you've read a number of the reports through the New England Journal of Medicine, the American Journal of Medicine, you will find that there is now reached a level in clinical trials. This is not a standard course of treatment in your local hospitals in Canada and the United States, where the white blood cells from the patient and the T cells combined together in a translational form of treatment will actually identify and has successfully treated leukemia, has successfully treated melanoma, and what we are like to do in the future and currently right now is to deal with breast cancer, especially the triple negative breast cancer and also cancer of the ovaries, in using the patient's own white blood cells combined with their T cells to create a form of immunization where it will go in, kill the cancer, and the patient will never get that type of cancer again. We feel that this is the wave of the future. We do not necessarily appreciate chemotherapy and the side effects that it produces for the human body, as well as radiology for the type of offsetting treatments and the type of side effects that this will produce for the human body. The last thing we would like to do is talk a little bit about some of the news articles which have been in the news recently, thinking particularly of a number of actresses and actors who have gone into specific treatment for cancer. What we like to do is take a look at some of these and help them raise the awareness for the type of cancer treatment that we are looking at, and maybe this would help them.
Down anymore. Okay, go.
One of the particular actors and actresses, especially the actress that have been in the news more recently, is the actress, as we all know, very famous actress Angelina Jolie, who had a scan and found that she had an 87% chance of getting cancer just as an inherent risk, and has undergone dual mastectomies. We find this is a very brave act. We laud her on what she's doing, but with the new type of treatment, had it been in place as a course of treatment, she would not have had to do that. And we're talking to other women who are going through mastectomies, whether it's single mastectomy or a dual mastectomy, and we feel that we can get and raise enough money to get this particular type of treatment, that is the treatment using white blood cells and T cells from the patient, that we will no longer need chemotherapy, we will no longer need radiology, a very minor bit of surgery to get the biopsy so we can discover what type of cancer it is, and use that as the course of treatment. This course of treatment using white blood cells will be available 10 years from now, but what we like to do is raise money for that so that we can help get that into the hospitals around North America to get that into there. So we'd like to thank you very much for listening to this video, and we'd like to ask you to stay well, be well, and have a great day. My name again is Eric Macklin. I'm with the Nancy Griffin Fund, and we sponsor the Macklin Medical Mission. If you just go to the left on your screen, you'll find the various websites so that you can make a donation. Thank you very much, and have a great day.